Hello, everybody. We are here in a live session, so please feel free to interact with us. And we have Professor Shafi Ahmed. You know quite well by now, probably. He is medical director at Medical Realities, but also chair at Giant Health event. We have with us Denise Silber, who is truly a pioneer in empowering patients. We have Matt Eagles, who is really an expert patient and the champion. And we have Paul Gordon that I'm going to circle back a little bit later. So we have a bit of a suspense right there. We are together here around Michael Sears. Some of you might know him, might have known him. He passed away this year, sadly. And with that, before I continue, I would like for us, all of us, to send our best wishes to his family, his children, and all his friends. And hope that Justin, his wife, is here with us today. We all knew Michael well. We've been changed by Michael. We've seen his light. And we are here. We have plenty of stories. We could just stay here for hours, but we will actually do what Michael would want us to do and focus on where is the patient empowerment today and what can we do moving forward for creating change in healthcare. Change that will embrace patients as equals in healthcare teams, as experts, and as true and fantastic innovators like Michael was. So that's like the big picture. So I will actually circle back to Paul right now because Paul is actually the chief marketing officer of the company that Michael founded, a very successful patient-led startup who is growing very, very nicely. But Paul was also one of his best friends for 20 years, so he knows Michael the best. So he's gonna give all of us a overview of his life, of his achievements, and of his really mission and his wishes. So, Paul, I'm gonna open it up to you.
Thank you very much, and good afternoon, everybody. And for probably some of my colleagues, it's good morning. So I'm Paul Gordon. I'm the Chief Marketing Officer of LYNX. That means I've got responsibility for marketing, for sales, and commercial strategy. But far more important than that, I'm a 20-year friend of mine. We first met when we were at the school gates, picking up children. He has 3 children. I have 3 children. They are more or less exactly the same age. Our kids grow up together. Our wives are best friends. I think Justine is probably on this. In fact, no, she's texted me a message 30 seconds ago. We literally are part of each other's lives in every manifestation. When I first met Michael, the licensing business, and he was damn good at it. He really was a fantastic licensing agent and was working for some major blue chip brands, football clubs including Juventus, big consumer brands like Disney and Warner Brothers. And Michael was in that space redefining the role of branding and merchandising. And the way he did that was basically, rather than just having the license and coming up with some interesting creative work to bring together their properties, he actually persuaded Disney, amongst others, to give him the license to manufacture products in China. So Michael was one of those brave guys. Brave is used to describe Michael, who went to China in the very early days when British and American business people went to China and products on their behalf. That was a very smart way of redefining the role of licensing. As I say, Michael was very good at it. In later years, when his began to be more of a challenge, he used the skills and expertise from branding, marketing, manufacture, and intellectual property think the interesting thing to Michael is that, unlike so many people who do suffer from chronic illness, Michael never, ever defined himself by his illness. If you ask Michael how he was, he'd say, I'm fine, how are you? Even if you're absolutely fine. He was infinitely more interested in your health than he ever was his, and he never wanted his health to define him. But his health was always there, and we will know that to be a part of his being. When Michael went to hospital to have the transplant in Oxford, and he recovered from it, he knew straight away that his future was not going to be about licensing. His future was about doing good. He absolutely believed that he was spared to do a job, and the job was to actually help mankind, humankind. And we used to talk a lot about this, Michael and I. And very much he saw himself in the way that survivors of the Holocaust saw themselves, as being spared for a reason to do good for humanity. And that very much is what Michael wanted to use his life to do. So when he hacked the sensor, which actually is the first thing he did to create what became LYNX, that was purely to deliver against the personal need. Medical bags, he called them dumb. It's a very good description of them. Hadn't moved on for 40 years. And this was kind of nonsense to Michael. Healthcare has moved on so much in 40 years, but it hadn't in this particular area of healthcare, in medical bags. He looked around for someone who could do it better to help him. There wasn't anybody, so he thought to himself, why don't I do it myself? He started a business in the US, in the US, after frankly being a little bit disappointed with the UK. He found the UK a little bit slow in order to embrace the opportunities, and thought there'd be greater opportunities in the US. And he was so right. I mean, who to America? I mean, most businesses that go to, British businesses that go to America singularly fail. Well, that's going to happen for Michael. The big movement, the big opportunity was when he managed investment from Silicon Valley investors who believed in his vision, who believed in the opportunity. And that really was the genesis for what was LYNX. In 2018, we launched the world's first smart bag. Back end of last year, we launched Smart Bag 2, which is the next iteration of the Smart Bag, completely transformational, nothing comes close to it. And he also launched, as part of our core proposition, our patient coaching service. Our patient coaching service is a way of patients helping patients. And this all comes from my personal experience, where he felt that technically there was an opportunity, but also on the human side, there was an opportunity as well. And that's the genesis of the patient coaching program. So here he is, small guy in stature, in the middle of California, launching his business. And all of a sudden, on the radar screen, all of a sudden people are talking about this great guy around with sometimes a t-shirt that's too small to him, in tracky bottoms that are always falling off him, throwing his meds around. And Silicon Valley is taking this guy seriously. Eminent doctors are taking this guy seriously. Who does that? Everybody looked at Michael and thought, this guy is transforming something. Let's get on board. Let's find a way of working with LYNX to transform healthcare. Because Michael always knew that just being a patient advocate in itself wasn't enough. He knew that in order to fundamentally change patient-led healthcare via a corporate machine, because otherwise you're just a soundbite. Otherwise you're just a pressure group. So the vision for LYNX very much is to create a business, and that business is to help more patients. And we can only do that if the business is successful. I moved over to America in late 2019 with my wife and my son. We lived 3 doors away from Michael. I saw him every single day. More often than not, I saw him at home because he wasn't well enough to go to the hospital. And at the final time, the final few weeks of his life, we were there. What I want to say is, on a positive note, is that I am part of the leadership team of LYNX. There are 2 other Brits that are part of it. Bern Gilby, who took the role of CEO when Michael passed. Dr. Robert Ferd, who's a British doctor, gastroenterologist in the UK, who's now our Chief Medical Officer, and myself. And we see our role very much as taking Michael's vision, bringing that to life commercially without losing sight for even a second of what he was about, which is using an opportunity to build a business that transforms patient care. Initially in our space, but more broadly beyond it. I take that responsibility very seriously. We're on our way to succeeding with 11 Health. It will take some time. And I know that he'll be smiling down on everybody who's on this call, everybody who's attending this conference. He's on my shoulder. I say this a lot. I say this to Justine a lot. Michael is on my shoulder. I feel his presence all the time. We're in meetings, and somebody will say something, and I'll shake my head and think, and I feel him on my shoulder saying, "Paul, I don't want to do that. Tell him I don't want to do that." So I do. We were so symbiotically connected that we more or less exactly what we were thinking at any given time, and I miss him hugely. But I'm empowered by his presence, by the vision he laid down, and I'm here to say to all of you here that keep an eye on what we're doing for 11 Health, because 11 Health is Michael. Michael's the embodiment of the brand. I talk a lot about that, and I'm sure he wishes everybody here well. This cause is incredibly close to his heart. He always saw patient-led healthcare as being the future. He felt he was spared in order to do that. He wasn't spared for long enough. And certainly, I speak on behalf of everybody 11 Health when I say that's the vision we have moving forward. And when we hire, and I'll shut up in a minute because I know there's a lot to cover on this call. I promise you I will shut up in a minute. When we hire, I am always involved in those hiring decisions. Not because I'm looking for skill competency. I'm not sure I can add much value when we're looking at hiring a hardware engineer. But I hire to make sure that whoever comes into the business understands the kind of cultural aspects of what we're about, the values that we're looking to achieve. Because ultimately, there are very, very, very few businesses that are geared in the way that we are. And ultimately, we know we'll be successful by helping more patients. So I'll shut up now and let the session continue, but hopefully that gives an introduction into...
Well, thank you, Paul. That's lovely. And thank you for bringing so much passion into your talk, because really this was really Michael, and I agree that I feel that he's here with us, and he will probably have a laugh looking at us right now. I miss him dearly as well. And what you said is what I think is very important for everyone to understand, is that Michael changed that particular field in healthcare. His innovation changed it, that's something that didn't happen in 40 years because of his experience on the hospital bed, his lived experience as a patient. And another point that
I think just to add to that,
and another point that
I was just going to, one thing that he... I was just going to say, one thing that he always said, and I think this will resonate with everybody, is that he knew that a lot of patients wanted to say what he said, but didn't have the confidence to say it. So he saw himself as a person who was their voice. A lot of patients, particularly patients who suffered from, they were disempowered by their own experiences.
But
he said, I'm not going to have this. I'm going to control them.
I can assure you, Paul, that he was definitely an example of perseverance and determination because he believed. When I met Michael Sears, he showed me the prototype. It was 2014. He showed me the prototype at a conference where no one else was interested. No one else. He gave a talk and he was left on the side. He was wearing a nice hat, He was undergoing his chemo. He was having a very weak voice. So he persevered a lot, and we've met across the world in conferences, when he was, brought in just to have a patient in the conference. And he was very aware, and he never stopped walking the line. And another point I would like to make everyone aware of is that he always believed in patient to patient, in the value that patients can bring to other patients. And he lived that, and he embraced that within his innovation, through the coaching service that they provide, that you guys provide. So that's another very powerful legacy that Michael is giving us, and that we have to embrace and move forward. And actually, for those of you who are interested, and thank you, Matt, for reminding us, Michael Sears, on his blog, you can check out Being a Patient Isn't Easy. He has a wish list written in 2014. And you could see that he actually did very well in checking some of the boxes there. But it's very interesting. We would like to hear your thoughts. What would you like as a patient today from healthcare? So if you want, you can, use the hashtag wishlist and hashtag Jan Health 2020, and we would love to get your thoughts on
Lorena, I would say not just as a patient. What do you want as a person who works in the period? Because as Michael so rightly said, healthcare is all about relationships. So let's get everybody who's listening to this involved with their wishes. So we're inclusive and we're collaborating with everybody.
And we are all equals in health, right? So Matt, actually, I was coming to you. So we would like to hear your thoughts. Why do you think real change will happen only if we accept patients as equal partners and innovators in health?
First of all, I must explain, if you see me moving about and suddenly disappearing off the screen, it isn't because I don't want to be here. It's because I actually live with Parkinson's, and I've lived with Parkinson's for 45 years. And it has a habit of getting into or controlling my body at times when it really shouldn't do. But going back to Michael, just very, very quickly, I personally consider myself to be a positivity activist. I'm actually head of patient engagement at the HAVAS LYNX group. But Michael is the epitome of positivity. I mean, people, it's super important, first of all, to understand that being a patient and illness aren't sort of life choices. People don't choose to become patients. People don't choose to have to fight for their well-being either on a daily basis. We all face the challenges in our lives, but it's how we respond that's key. Finding motivation and inner strength when always in a crisis takes a particular mindset. It takes resilience, determination, passion, the ability to communicate and engage. Michael had this mindset, this strength, this desire to disrupt healthcare, enough to make a massive impact and to change people's lives. Now, as a patient, playing an active role in your own well-being is crucial, and none more so now during the global pandemic. We've all learned what's important in life, what are the real essentials. We've all become more conscious of our own mortality, how much we love our families, and how important healthcare is, and particularly in our own well-being. And if I may, I just came across this article recently by Dr. Catherine King in Psychology Today, The 7 Principles of Resilience and Practical Ways to Enhance Wellbeing. And they were perhaps going off topic a little bit, but this is so pertinent to Michael. Principle 1, cultivate a belief in your ability to cope. Principle 2, stay connected with sources of support. Principle 3, talk about what you're going through. Principle 4, be helpful to others. Principle 5, activate positive emotion. Principle 6, cultivate an attitude of survivorship. And principle 7, seek meaning. Michael practiced all 7 of these. He was resilience personified. And this enabled him to establish the relationships with clinicians, nurses, academics, industry and family that's so crucial in healthcare. He actually said before that healthcare is about relationships. It's about mutual trust. It's about mutual respect, and it's about mutual empathy. Give what you wish to receive. Empathy, which is one of the crucial things, and I've had to write this down, it's so good. Empathy is what Michael, he's just again, empathy personified, seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. Now, this doesn't just apply to Michael. I'm not going to embarrass Shafi, but Shafi, to me, is a similarly innovative and inspiring clinician, surgeon. He inspires me in a very similar way to the way Michael did, and still, indeed, still does. So I hope I haven't embarrassed you now at all, Shafi, because that really does come from the heart.
That's really kind.
We're all friends coming together, so.
But yeah, just very, very briefly, a true relationship, and this is another quote from one of Michael's talks, a true relationship is two unperfect people refusing to give up on one another.
Oh, this is beautiful.
And I love that. I really do. Just very quickly, his passion and only captivated his audience when speaking about health tech. It was obvious what he wanted. He spoke about solutions being given to the end user rather than being built with them. I think we've seen a little bit of progress there in collaboration and co-creation, where new startup firms actually do contact patients and ask them what they would like, what is their biggest problem, because that's one of the biggest issues in healthcare, particularly with health tech. People think of ideas and then go to the patients when really they really need to sort of truly understand what the problem is that they're trying to solve in the first place and understand the needs of the patients. I'm sorry, my microphone appears to be a bit noisy, apparently. I do apologise. But meaningful change will not happen unless you engage with patients first. And it starts from the top, and you have to be brave. And I put another hashtag out here, and it's hashtag be like Michael.
Be like Michael, indeed. He was brave and persevered, and he had a wonderful sense of humor, so he went through everything with a smile. So Denise, you've met Michael for a very long time, and he visited you at your conferences where you really supported so many patient voices, and you've done so much for the movement, if you want, and you really created progress in that sense, and you are still doing that. Do you have any thoughts on what we could all learn from Michael?
Yes, absolutely, because thank you for asking me that. Michael would never have wanted to be perceived as a Superman, as a hero. He really considered himself just one of us, just a person, an imperfect person. And I would hate for this tribute that we can't help but do to him to have people come away saying, well, there's Michael, we can't do that. And so I have reflected on, yes, we can, which is to understand that when you are a patient who is potentially in a situation where one could lose one's life, I believe that that gives everyone a clarity of purpose. And I believe that it was this clarity of purpose, which all of us can have, that is the fuel for all that we are saying about Michael. And with this clarity of purpose, you can become what I believe he truly was. Now, you're going to laugh a little bit, but it's not funny. I'm going to use the word surfer. He was a fearless surfer, and I believe that we can all surf on the waves I'm going to describe, which because I followed his career in healthcare. He began when everybody was doing a blog on the web. He used that blog to get in touch with others and then surfed onto the wave of social media. And it was through social media that he identified the surgeon in England. It was someone in New York who told him, it was a doctor in New York who told him that there was a surgeon in England who could do the transplant. So he surfed onto social media. Through social media, one became aware of conferences. That is where I met him. I met him when he was at Medicine X. I had already started Doctors 2.0, and he was not yet a speaker. And as soon as I got there, he said, I see you're setting up a conference in Europe. May I speak at that? And so he became a speaker at not just my conference, but at many conferences where we would follow one another. And at one point, he realized that he could make that prototype. There wasn't just the prototype for the ostomy bag. He also was working on a prototype for a backpack. He had various ideas because he was a bit of an inventor. And then from that, he had the idea of going across to the US. And because he was an insider in the hospital, he knew with whom you would have to speak to get things done in a hospital and to put himself on the way to getting reimbursement. To get reimbursement, he just went on the web. I remember him telling me that. And he found out what was required by the different governments. So what I have laid out is the fact that if you want to be like Michael and you have this clarity of purpose, you then adapt to the opportunities that you will see because you know what you want. And what do you want? You want to make lives better for yourself, the patient, and for all patients, because you can't really make it better if there's only one person concerned. If you want to make it better for yourself, you have to make it better for the professionals and for all the patients. So that is why I would say that if we all can surf in an adaptive way with clarity of purpose, we can carry on with Michael's work and continue to improve the world of healthcare and the world at large.
Thank you, Denise, and thank you for saying that Michael was not a superhero. Well, in a sense, he was for all of us, but he was very deeply human, and he had tough times. And I remember we were having the pizza, the conference, and he was really, I don't know, he was feeling a bit sad and demotivated, if you want, because he met some big surgeons, and sorry, Shafi, I'm not passing on this to you. He met a surgeon that said that patients actually won't care about his innovation, and he was really concerned. He was, really thinking if he's doing something wrong or if this is actually true. And they said, Michael, you came up with this because you were on a hospital bed. Apologies for the unexpected break, but Denise just finished up giving us some very insightful lessons from her experience with Michael and from his life. And one of the most important one is that you don't have to be a hero. And Michael had his tough times, and probably that's one of the reasons why he really valued friendship above all. He was a loyal friend, and he realized, as a patient, you realize that you cannot do things alone. And he realized very early on that he cannot also innovate on his own. So he needed his tribe. He needed people that he trusted. And then she also mentioned that he was a surfer. So he moved from the UK to the US. But this also was a challenge for Michael, because he found it difficult in the UK to push through and develop his innovation, and that was one of the things that made him really sad. And I'm glad that I'm going to Shafi right now, because Shafi broke some rules, and he created new paths in healthcare on his own end as a doctor. So he's been through what Michael has been, but from a doctor's perspective, in a sense. So he knows how to be told no, that this is not possible. Shafi also knows that it takes courage to change medical education, change perspectives. So Shafi also knew very well Michael, so they were very good friends. So Shafi, please tell us from your own experience, but also from what you learned from Michael.
Sure, what a great pleasure to be here to remember Michael, who was an extraordinary individual and who's of cancer or further complications. You never heard him complain or moan about his own problems. He was saying, how do I help other people? So Michael was a number of things. He was an innovator, he was an educator, of course, he was a brave person, he was a patient, and also he was someone who just understood humanity. Whenever you talk to him, it wasn't about that, it's just about humanity. How to make people better, happier, live longer, spend more time in well-being.
Okay, I
and I think
we
that's
are
his
live
main
right now.
legacy that he's left us.
Yeah,
And he's inspired many patients
Yeah.
also along that path.
I'm curious, Shafi, as a doctor, what can we do to create this bridge of trust between doctors and patients, so we can trust what they bring to the table, because the patient brings the lived experience, so they can innovate from their own experience, and the doctors, they bring the skills and the expertise, the knowledge from medicine.
Yeah, we need to listen to each other, Claire, and that's what it is. Look, we historically as doctors have been very hierarchical. We manage our patients. We know best. This is what we've decided, etc. And often the person missing from that conversation is the patient. So one thing that Michael did leave us is this whole concept of changing the way the companies run. So I remember him coming up and saying, look, we have the chief medical officer in a company, we have the chief operating officer, we have the chief executive officer running the company, etc., etc. We never have the chief patient officer. Why don't we have a CPO in every organization in healthcare? The patient is involved in those conversations. And I think his legacy going forward is the chief patient officer.
It was on his wish list in 2014 that NHS should have a chief patient officer as well.
Yeah.
So that's one of the things. And what can we do to move things forward? As you said, he was an educator for patients, but he was an educator for doctors too, and for healthcare as a whole. So I think that we can all do that individually, but is there something that you think that we could do from inside the establishment of healthcare to improve that?
Yeah, so look, it is upon us to create that, I guess, the ecosystem, the environment where people have a voice. And I think one of the things I've been striving for many years, Lorena, is how do you put innovation is the heart of every organization? How do you bring innovation to the heart of the NHS, for example? How do you empower people to think differently, to allow them to have that voice and that vision, if you like? So I think that's part and parcel of it. And I think Michael just showed glimpses of what could be possible. It's up to us. We have, in the NHS, of course, we have a number of organisations, NHSX, NHS England, NHS Digital, etc., etc. Each institution itself, every healthcare trust, is to embrace those ideas and ensure that we innovate together. So I think one of the key things is how do we bring that technology, how do we bring innovation, and how do we kind of embed it into people's mindsets and into practices.
So I will bring it a bit towards the end now, because we don't have much time left. I will bring it to the present because, but also drawing on the past. In 2014, Michael was saying that he would love to see doctors interacting with patients via Skype, for instance. So now, we interact via Zoom, via Skype, via WhatsApp, etc. with our doctors because of what happened this year, because of the pandemic, on one hand. On the other hand, we've seen a lot of decisions taken top down, and there was actually an article on the British Medical Journal saying that, this year patients were not involved, and NHS was, supposed to become more patient-centered, but this year patients were not as involved as they've been. So do you think that, do you all think that patients are not being heard this time, so anything like that presently? Yes, Denise.
Well, we're in a time of crisis. So crisis has a good side because sometimes it gives opportunity to do things in a new way, which we have seen with teleconsultation. But I think that there is a long-term need to really inject and make communication as a skill, as a course, as an education, something that is required and noble. We've gone so far in valuing STEM that it seems to be at the expense of humanities, and in particular, something like communication, which has never been recognized as a tool for a healthcare professional. Independently of all that we've been saying about patient advocacy, so far we know that internally to the healthcare profession, to the surgical team, communication is of the essence. Everybody must feel free to make a good suggestion or to point out a problem. So I think if there's one thing that Michael could agree to and that we could all agree to.
That's very true, and I think the crisis also showed us that we still have a long way to actually integrate the patient. The patient should be also part of the conversation.
Absolutely.
Crisis
if we understand that communication must happen amongst everyone, it's patients included.
And in every situation. So, any opinion, Shafi?
Yeah, I'm saying that I think that Denise is right. This has been a huge transition for all of us in the last 9 months with the pandemic. We've seen acceleration of innovation. We've seen telemedicine being used, and obviously Mike mentioned Skype before. So I think part of these wishes have already come alive because of the pandemic. We're now doing remote consultations, up by 8,000% in most institutions. We're now never going to go back to what's the old normal, of course. We're now going to be in a more remote virtual world, whether it's patient consultations or, in fact, education. So I think Mike got his wish there. Obviously, it is precipitated by a global pandemic, but it's part of the way there. But what it's allowed us to do is think differently. We're going to exploit that. We're going to explode. We're going to propel ourselves into the future. I think Mike would love to have seen this. He'd love to have seen where we are now today compared to 9 months ago. And I'm sure that's part of his vision that is now being realised for all of us.
I was going to say that the pandemic has really brought to light some of the inequities in health as well. The differences in cultural standards, in health-seeking behaviours in themselves, and access to healthcare as well. Now, I think one of the beauties of Michael was communication. And I'm sure he would have stood up for the people who perhaps didn't have a voice. But this whole pandemic has really emphasised the differences between different cultural communities and how they're. I mean, we all want to see health-seeking behaviours become the norm. We want people to be as comfortable accessing their healthcare as they are on Amazon or on TikTok or on social, because that way we can all help each other.
Sure. And I would like us to have maybe a thought on one of Michael's. And Paul, do you have any opinions on what's going on today on the role of the patient? The voice of the patient.
Yeah, I just want to obviously I speak with a British accent, but I work in America, so I'll give you an American perspective on things that I know it sounds incongruous, given the way I sound, but in our space, and I'll talk from our space. I think that's my role on this panel. Is that remote patient monitoring, which is essentially is our take on life, is here to stay. I think what we're finding in the States is that obviously hospitals are just inundated with pressures that frankly they couldn't have possibly contemplated, and I don't know what that means for the next 3, 6, 9 months. I'm not sure. God Almighty knows what's happening in the next 3, 6, 9 months. But I think that certainly we're finding in our conversations with clinicians is that any party that can basically augment inpatient care, out of patient care, with or out of patient care, is hugely important. And that's essentially what we're about. Doctors and nurses and hospital administrators, your patient's really important, but you can't cope with that amount of patient throughput. We can basically augment your in-hospital support at home. It is essentially what that's about. And I think that goes back to the point about partnership and communication. I think that's certainly where providers and brands like us come in, about helping the patient at home, because the hospitals can't cope.
And it's also a bit of a transfer of knowledge here to the patients along with the care, which is, it's going to create a new wave of innovation, in my opinion. I don't know if you agree, because the more people are becoming more skilled, if you want, in their own health, they will have better and better ideas about how to improve it. Okay, and so we touched on the remote monitoring as well, which was on Michael's wish list in 2014. So this also happened this year, and is going to, is going to have a boost starting forward. It's something a bit ironic, but also something to enjoy that these things happened. Michael would enjoy that. On the last, we have only a few minutes left. So I would like us to maybe put forth our wishes as well and our thoughts, about healthcare. So personally, well, what I learned from Michael is, mainly to not give up, to being a bit stubborn, and have a good joke, but keep doing, going your own direction, and creating, as Denise said, serve and create a tribe, and understand that things can be done only together. So this was my primary lesson. Denise?
Yeah, I was just wondering, because there's so many people who love Michael and who would like to see his legacy pursued. I'll bet you somebody's already thinking about some sort of an award in his name. But if there isn't, I would certainly think that Giant Health, at the least, which would not preclude other awards, could run a competition next year or from now for the best ideas about improving the essential problem that you raised a few moments ago, which including the patient in communication. How can we improve that structure or the organization of healthcare so that the patients are freer to communicate and are more heard, and give prizes? This could be thought out. It could be at all different levels, prizes to individuals, to organizations.
I wanted to close with that, Denise, because Barry announced actually in June that we are going to have a prize. The big prize at the startup competition at Giant Health event is going to be in Michael Sear's name.
I didn't know that.
Yes, I wanted to close with that. So I'm very grateful. So we can thank Barry and we can thank Shafi here, because he's the chair of the Giant Health. I'm very, very humbled and proud to be part of the first year jury for the startup competition. So that's a wonderful idea, Denise, and that's one way to shine light and one way to keep pushing things forward. And Shafi, you also, you've been involved in the prize. Give us your thoughts.
Yes, of course. So the Basil's competition we do every year at Giant. We ask innovators to come across around the world to submit ideas, and we'll be giving out prizes tomorrow. In fact, tomorrow there's an award ceremony, at about 2 o'clock in the afternoon, which I'll be hosting. I have my black tie on, of course, and I'll have a glass of champagne, non-alcoholic, because I don't drink. But nonetheless, we'll try to bring the community together. We have 12 awards tomorrow to give away to various people, including Entrepreneur of the Year, for example, Best Tech Innovation, Best Application Immersive Tech, Best Tech Innovation in Pharma, Women's Health Tech Innovator of the Year, Best Wearable Tech, etc. So we have 12 different areas, so come and join us with perhaps a glass of champagne to cheer on the success stories of 2020.
So what do you think Michael would say about having the prize on his name? I think he would feel a bit, embarrassed and humble.
He'd be embarrassed. He's so humble. He never wanted any gratitude or platitude or anything. He was just a very simple person. And I think that he'd appreciate it, but he'd be a bit embarrassed, of course. But quite rightly, he deserves to have that in his name.
And Paul, quickly, because we have only 3 minutes, what do you think Michael would think about the prize?
Yeah, he would be a bit embarrassed. He probably it should. He should probably say no. It should be in someone else's name. So because he was a humble guy. But I think it's a lovely thing to do. And I would say just that honouring him. Justine and I are in the process of working out what the structure might be for something that one might call the Michael Sears Foundation, which will be It's to be defined and developed, but will be a mechanism for us to essentially raise money for causes that we think that Michael would support, causes which give people opportunities to bring things to life, which of course that he was given. So more on that to follow, and Matt's showing a picture of Michael, and I think that's a lovely looking picture. I think you caught him at his best there, Matt.
I think that is the best thing to have a prize on somebody that who would be too shy, in a sense, to have a prize on his own name, because his legacy is just so deep and so sweet, and I think it's a wonderful thing. And we'll close with Matt, I think. So tell us about the picture.
That's actually part of the Healthcare Heroes book that Michael appears in, that was done by HAVAS LYNX. And I think that's an absolutely beautiful picture. And it's taken by a guy, I think it's a photographer called Chris Roberts, I think his name is. But it captures him so well. But I think I'd like to close by saying, if anything, if you're going to speak, if you're from a patient perspective, certainly, be brave, be courageous, be yourself.
Be yourself. I think Michael would agree. Be yourself, really. And I think we ran out of time, so thank you.
I would just say that this has been a really happy session, and he would have liked it.
Yes, I agree.
Once we got past the beginning.
Michael would love that.
We're all still smiling anyway, just like Michael does.
Thank you all who watched us, and I hope we'll meet again and keep the conversation going, really, because we are not there yet. Michael knows better than all of us. We are not there yet, so we have to keep going. Thank you all, and we have to cut short right now. So
thank you.
Thank you. Bye bye.
Bye bye.
Bye bye.